Meet Amina. Amina is 28, 8 months pregnant and excited to welcome her first child. She lives in Bukombe district in rural Tanzania. When she goes into labor, she reaches for her phone to call Asha, her community health worker who's checked on her every month during this pregnancy. But the call does not go through. Asha stopped working because funding for her stipend ran out. Amina makes it to the closest primary healthcare facility. She's hemorrhaging. The nurse reaches for oxytocin, the one drug that could save her. The shelf is empty. It was never restocked. Unfortunately, Amina loses her life and her unborn child's life. Not from a disease with no cure, from a supply chain that broke somewhere between a national budget and her village. Amina would have survived if Asha's stipend had reached her and if that hospital shelf had been stocked. Nothing about her death was inevitable. It was a financing failure wearing a medical face. Amina is not alone. Across Africa, a child is 17 times more likely to die before age 5 than a child in Europe. More than 615 million people still cannot access essential health services. Every year, closing the financing gap for essential care could avert 2 million deaths and stop 150 million people from being pushed into poverty by out-of-pocket expenses. Africa faces an estimated $4.4 billion annual financing gap for community health, while the financing gap for primary healthcare is even greater. Despite PHC being able to address up to 90% of people's health needs, many countries continue to invest more in costly hospital-based care, leaving families to shoulder an average of 35.8% of health spending through their pockets. The challenge is not only how much money is available, but also how it's spent and reaches the frontline workers. Across Africa, an estimated 13% of health budgets goes unspent each year due to weak public financial management systems. The result? Mothers like Amina cannot receive life-saving care. Children miss their routine vaccinations because health facilities are not adequately stocked. Community health workers like Asha cannot reach the next village because they are not well facilitated. Only 3 of 52 African countries have met their own Abuja commitment to health spending, and what's more, today, Africa faces an even bigger challenge: a polycrisis. Growing populations, climate change, disease outbreaks, economic pressures, declining donor funding, and rising demand for healthcare. The Financing Alliance for Health works with Ministries of Health and Ministries of Finance to make health financing systems work better for people like Amina. We help governments not only mobilize more money for health, but also more health for the money through strategic purchasing for high-impact programs such as primary healthcare and community health. We support them to direct more funding to primary and community healthcare. We strengthen public financial management so budgets translates into essential health commodities, paid health workers, and functioning health facilities. We build capacity through our Health Systems and Financing Accelerator Fellowship Program, embedding the expertise and systems needed for lasting health financing reforms. We generate evidence and support evidence-based policy making so countries can allocate and use health resources more effectively and equitably. By improving how health systems are financed, we can help create a future where Amina's story is the exception, not the norm.